He is sitting down with us today as the real architect of the Harm Reduction Conference. Now, this was your brainchild, they tell me, and tell me about how you came up with the idea and what you hope to achieve with the meeting.
Well, the idea really came out of my years of clinical experience as an emergency medicine physician. I've been in the legislature 21 years, but I've been an ER doctor for about 30 plus years. And so much of what I was seeing in the emergency room was social problems, and the largest number of social problems were driven by the war on drugs and the addiction issues.
Tell me about the role you see the Institute for Health and Social Policy playing in the harm reduction meeting.
So the Institute has been established originally to look at questions that are at the cusp of major health and social issues. So this is clearly a major social issue. And so I was very glad when Dan Morheim and Beth McGinty, who are both associated with the Institute as faculty, came to see me and asked me if we will be interested in hosting a major symposium on harm reduction. I thought it was clearly within the mandate and mission of the Institute, and the rest will be history.
In your tenure as mayor,
Right.
What were the experiences you had as a policy leader in dealing with the problems of addiction and drug-related violence?
Well, clearly, when I became mayor and I looked at our city, well, we've got a great city, but unfortunately it was a tale of two cities. On one hand, we had some great, wonderful activities, the best of urban America, and then 8 blocks away from the best was some of the worst. And a lot of that had to do, the worst aspects of the problem had to do with substance abuse, and what, in my view, was kind of the three-pronged aspect. It was addiction, it was a crime associated with distributing drugs, and it was AIDS. And so what we had to do as a local government was to try to figure out ways to address the problems of AIDS and addiction and crime, and clearly two or three of those are public health problems.
As we have this shifting landscape of drug policy in the U.S., we're really doing a lot of work at this stage to think about what lessons we can learn from other countries who have tended to take much more of a harm reduction approach than the U.S. I think that efforts like today's meeting are a sort of one key step where you get people in the room who are on the ground in the addiction treatment communities and the law enforcement communities, along with researchers, right? We're talking to each other. Imagine that crazy concept. That doesn't happen, I don't think, often enough.
Tell me about your work on the issues of addiction treatment and drug policy, and how did you first get involved in these issues?
So I first got involved in these issues because of the dual hats that I wear. As a legislator, I think our job is to help serve the community, particularly in areas where, and for constituents that don't particularly have that voice. But as a physician, I think it's incredibly important to look at addiction and drug abuse as a medical condition. And I bring that hat because I believe we can treat it, and we do need to treat it. And there's a lot that we can do to help promote policies that will help people. And I think for too long we've looked at policies that really look at addiction and drug abuse from the opposite lens, that of law enforcement, and that it is a behavioral choice. And I think that's the wrong way to look at things. And if we can change that paradigm and look at the issues and concerns with drug addiction and drug abuse from the perspective of a physician and from the perspective of the fact that it's a chronic disease, that there's a lot more that we can do to help bring people back from that and reintegrate them into society in ways that can be productive rather than taking them away from society in ways that are counterproductive.
Having our eyes wide open and looking at the reality of the situation. Going forward even more aggressively, potentially having a conversation about safe injection facilities. That's something that's happens throughout Europe, has been an insight. There's a safe injection site in Vancouver and being discussed in San Francisco and New York right now, as well as other jurisdictions. Having conversations with the police about alternatives to arrest, because in so many ways police are really the first responders and really see so much how drug use affects our society, particularly the members of society with whom I work. So really trying to articulate what joint efforts can be by public health and public safety and changing the respective norms of each of public health and public safety to come up with solutions?
Well, I think in some ways Maryland represents what's going on in the rest of the country. And I think that is, we have seen that our current policies have failed.
Educate folks around, what do we really need to do before we even get to the legislature, because otherwise we're going to end up with so many voices speaking to the legislature that it's going to get garbled. There's this connection between, the criminal justice response to addiction and the public health response to addiction. And in many instances, those responses are clashing, and we need to do something about that.
We do look at this addiction as a brain disease, and it has to be treated in the public health sector, and it's certainly, with the arrest record being what it is, being punitive is not the answer. The drug policy situation in the United States, if it's looked at as a public health crisis, then I think that you will get more people to, how should I say, be on board with it.
We speak on Capitol Hill about the harms of our current war on drugs and how they affect the lives of people, and how we have given law enforcement this duty which shouldn't be theirs.
Regulate and control all drugs. Take the market away from the cartels and the illicit gangs and move it into the hands of medical professionals that are trained and understand how to cope with substance abuse disorder and understand how to deal one-on-one with people who have problems.
Many people who sell drugs in Baltimore would love to have a safer occupation in which when they go to work each day, they don't have to worry about whether they're going to come home or not.
Well, I hope that this is an open moment where a change in policy, and that's part of what this meeting is about, is to really drill down to policy changes that we can really make, shift the war on drugs from the destructive way that it's been to shifting into a recovery from it and a support for people and communities.